Sairam everybody, thank you for joining us this evening for tonight's webinar on Heart Matters. For those of you who don't know me, my name is Harsha and I'm the Region 5 Healthcare Committee Lead. With us tonight as our webinar speakers, we have Dr. Mahesh Shah, Dr. Thomas Key and Nirali Sisodia. I'll now give you a little bit of background about each speaker. Dr. Mahesh Shah qualified from the Hull York Medical School in 2010 and has been a practicing GP since 2015. He's based in northwest London. Despite his supportive role as a GP in his local community, he's always felt that people don't have to live with disease. This took him into the field of lifestyle medicine, embracing a holistic approach to health by looking at nutrition and well-being. He qualified as a naturopathic nutritional therapist. He now has his own holistic nutritional therapy practice, The Green Doctor, helping people with chronic health issues through diet and lifestyle. Dr. Thomas Key currently works as a cardiology registrar at Kettering General Hospital Foundation Trust. Having graduated from the University of Southampton, he has completed placements in a wide variety of specialities before choosing cardiology as a career. He currently works on the coronary care unit, specialising in patients with acute cardiac presentations at a centre that offers 24 hours a day, 365 day care for acute heart attacks for the Northamptonshire region. Nirali Sisodia is a senior PCN pharmacist for Wellingborough and the East Northants region. She trained at University Hospitals Leicester and Kettering General Hospital, becoming a senior cardiology specialist pharmacist, her key areas being ACS, heart failure and anticoagulation management. She's also an independent prescriber, as well as being the Region 4 Healthcare Lead and Joint National Young Adult Coordinator for the SSSIO UK. We hope you enjoy tonight's webinar and you're able to take something from it. Sairam.
Good evening, everybody. Welcome to the webinar on Heart Matters. We're joined by Dr. Tom and Dr. Mahesh Shah, who will be going through cardiovascular disease and the lifestyle choices that we make. So without further ado, over to you, Dr. Tom.
Thanks, Nirali. And my name is Dr. Thomas Key. I'm one of the cardiology registrars at Kettering General Hospital in the UK. So why is this so important? So why is cardiovascular disease so important and something we all need to know more about? Well, if we look at the numbers, first of all, so I'm sure we're all familiar with numbers being thrown around, especially with COVID and our daily sort of updates in terms of that. But I'm not sure many people will know that actually over 7 million people in the UK actually have a heart or circulatory disease. So for a population of around 60 million, that's more than one in 10 of us walking around with a heart or circulatory problem. And on average, it unfortunately claims the lives of about 460 people a day in the UK, and actually causes more than 100,000 hospital admissions a year to our NHS hospitals, which, as I'm sure you're all aware, are under extreme pressure at the moment. And just to put it in further perspective, one type of circulatory disease is a stroke, and it is very much related to the heart and the circulation. And actually, one person has a stroke in the UK every 5 minutes. So anything we can do to raise awareness around that or actually reduce the numbers is obviously going to have a massive positive effect in not only our lives, but the people around us that we know. So just an overview of the session. So what we're going to go through is essentially what is cardiovascular disease, delve a bit more into that. We're going to focus with Nirali on hypertension or high blood pressure. And then I'll come back to talking a little bit about angina and a heart attack and talking a little bit more about that. And then we're very lucky to have Dr. Mahesh Shah, who's going to talk about lifestyle changes we can make to actually prevent cardiovascular disease. And throughout all of this, we're going to follow a patient profile of how they may experience cardiovascular disease in terms of going to the GP and what other symptoms they might experience. So just to kick off, what is cardiovascular disease? So cardiovascular disease essentially means disease of either the heart or the vascular system, which is the blood vessels that go around the heart. It's an umbrella term, so that means that it covers a wide variety of medical conditions. Most commonly, these are things like heart attacks, coronary artery disease, which can cause things like angina, heart failure, where the heart doesn't pump as well as it should do or did in the past, a stroke, where you get a lack of oxygen to the brain, and resulting possible disability from this. High blood pressure is another example of a cardiovascular disease, and some forms of dementia are caused by a cardiovascular cause as well. So just over to Nirali, who's actually going to talk us through a little bit more about high blood pressure.
Thank you, Tom, for that. So we'll just be going through briefly about what hypertension actually is, and what do the numbers mean? What are the risk factors that can give you high blood pressure? What can it cause as well? And how to actually take your blood pressure at home. And again, we'll be referring back to the patient that we will be talking about as well. And obviously during this time, we're in this time of COVID, GP surgeries haven't been able to, invite patients for their regular blood pressure checks, which has meant that a lot of patients are having to take their blood pressure at home. So, we're going to talk through about how to actually properly take your blood pressure at home and what those numbers truly mean. So blood pressure is actually recorded with two numbers that you'll notice, and you'll notice that one number is higher than the other number. So you've got this higher number here, which is the force at which your heart pumps blood around the body. The lower number, or the diastolic number, is a resistance to the blood flow in the vessels. So it's all surrounding about the pressure that your blood pumps around the body. So as we mentioned before, there are two numbers. Now a normal blood pressure is considered as 120/80. So this is what we term the systolic pressure versus the diastolic pressure. So your systolic pressure measures the blood pressure in your vessels when your heart is actually beating, okay? Which is why quite commonly you'll find that you will always have your blood pressure also done on your left arm, because your left side of your heart pumps the blood around the body. Your diastolic measures the blood pressure when your vessel is when your blood vessels are at rest between the beats. So if 120/80 is considered to be a normal blood pressure, then a high blood pressure is actually considered to be when your blood pressure is over 140/90. That's when we should be really looking at what can we do, what interventions can we make to keep that blood pressure low. If your blood pressure is less than 135/85, then the recommendations as per the NICE guidelines, which are our national health guidelines, say that you should get your blood pressure checked every 5 years. Undoubtedly, you will be called by the GP surgery to prompt you to have your blood pressure done as well. So what are the risk factors to actually acquiring hypertension? That's what we term high blood pressure. So if you are obese, then that can give rise to high blood pressure. Your gender, so if you are male, then you're more likely to have hypertension. Also, if there is a familial trait within the family, then that also predisposes you to having blood pressure as well. Your job environment. So if you're in a high stress job, or if you're in a job where you're sedentary, so you're sitting behind a desk, not having much movement, that can also contribute to you having high blood pressure. A high salt diet as well. So Dr. Shah will touch upon this as well in his session. But essentially, what happens is water follows sodium, which is salt. Therefore, that can contribute to actually retaining water in your body, which can therefore cause higher blood pressure. Stress can also cause high blood pressure. Other conditions such as diabetes can cause high blood pressure. And so can the types of foods that you eat and also your age. As you get older, the possibility of you having a high blood pressure can also increase. So if you do have hypertension, however, what can hypertension potentially cause? It can cause symptoms of angina, which Dr. Tom will go through, heart attack. It can also cause heart failure as well, which is the inability for your heart to pump blood around the body. It can also cause kidney disease, and that's because of the pressure that the fluid that's retained in your body can actually cause on your kidneys as well. It can also cause stroke and aortic aneurysms as well. So how do we actually take a blood pressure at home? So there are lots of brands of blood pressure machines out there. And what I would suggest is to actually buy one from a reputable brand such as Omron. They are quite good. Also, your pharmacy will also have a blood pressure machine, which is reliable, that you can buy as well. So you also want to make sure that you use a blood pressure machine that uses a cuff instead of wrist monitors. So the wrist monitors can actually be inaccurate and may not give you your actual blood pressure. So when you do take your blood pressure at home, you do need to make sure that you are sitting on a comfortable chair with a flat back and you are in a calm, non-stressful environment, and make sure that your feet are firmly flat on the ground. Next, you also want to make sure that you're not wearing something that's too tight, so that you've got the ability to roll your sleeve up. You want to be sat and relaxed for at least 5 minutes before taking your blood pressure. Then you want to lay your hand flat on the table. Then you want to put the cuff 1 inch above your elbow. Note here that the wire must be pointed downwards and the arrow is actually pointed towards the main vessel in your arm, which is just above your elbow. You want to make sure that the cuff is securely placed around your arm with 2 finger measurements between the cuff and your arm. Then you press the on button on your blood pressure machine, and then it will automatically take the blood pressure for you. Ideally, you want to take your blood pressure in the morning and in the evening. If you find that your blood pressure when you take it is slightly high, you want to wait for a couple of minutes and take the blood pressure again. Ideally, you want 2 recordings in the morning and 2 recordings in the evening, and therefore you can take an average. And this just gives your GP a really good idea of any factors that may be also influencing your blood pressure as well. And you can either drop these into your surgery, or you can even email them if they have that facility available. So if you find that your blood pressure is high, and then you contact your GP or your pharmacist and you have a consultation with them, they may discuss about medications with you. And many of you may already be on some of these medications and may recognize some of the names. So things like calcium channel blockers such as amlodipine, ACE inhibitors, or angiotensin receptor blockers, ARBs, such as ramipril or losartan. You also have thiazide-like diuretics, which are indapamide and bendraflumethiazide. And finally, you have potassium-sparing diuretics, such as spironolactone. All of these work on different elements of your body. So, for example, amlodipine actually works on your blood vessels. Things like the thiazide diuretics can work within your kidneys to promote the loss of water, to lower the blood pressure in your body as well. So back over to you, Dr. Tom, to talk a little bit about our patient.
Thanks, Nirali. So we've just got a patient with us this evening on this presentation, just to demonstrate their journey through cardiovascular disease. So here we've got Mr. John Smith, very generic UK name. He's a 60-year-old chap. He's a gentleman that is probably quite typical of someone living in the UK. He works as an accountant. He's got quite a sedentary job, as Nirali touched on earlier. He drinks a little bit of alcohol. He drinks 4 pints in the pub when he's allowed to, with restrictions, twice a week on a Friday and Saturday. He used to smoke cigarettes. He used to smoke 15 cigarettes a day for the last 30 years, but he did give up a year ago after he started getting some symptoms that we'll touch on. And he also has some family history of heart disease. So his father unfortunately had an MI, which is another word for a heart attack, at the age of 55. And his mum had a stroke when she was in her 70s. As well as his brother, his sibling, has type 2 diabetes, which is another risk factor for heart disease. Now, at the moment, he doesn't take any medications. He feels fit and well. But we'll follow his journey through this. So one of the most common questions really is how do I know if I have cardiovascular heart disease? So as Nirali was touching on, you can work out if you have high blood pressure simply through the numbers. Working out if you have cardiovascular heart disease is a bit more tricky. So there are warning signs that we can all look out for. Now, these become more common when you have an increased risk factor profile. So someone who is smoking, someone who's drinking more alcohol, if you're overweight, the same risk factors for high blood pressure put you at higher risk of having heart disease. Now, some of the key features to look out for are typically, and the one we know most is chest pain. And this chest pain is usually when you're exerting yourself. So it may be that when you're going for a brisk walk, or if you're walking up a flight of stairs, or doing something that would normally make you out of breath, but you're now getting a heaviness in your chest. It could also be things that are less associated with the heart, so such as a pain or weakness in your arms or legs. It could simply be feeling short of breath more easily than you used to. And it could be something like feeling palpitations in your heart. Now, palpitations is a word that means different things to different people, but it's essentially an awareness of your heartbeat, and that can mean it either feeling like it's racing and it wants to come out of your chest, or it could be that you're having the sensation of missed beats in your chest, or that you're missing heartbeats every now and then. It could also be things that you may not put down to your heart at all. So things like feeling excessively tired all the time, getting very tired very easily, perhaps at work or when you're walking to the shops. And also swelling, mainly in your lower limbs. So it may be feet or ankle swelling, or even when it gets worse, could even start coming up towards your knees or further. So our chap, Mr. Smith, he was out walking with his family, and they decided to go on a lockdown walk, essentially, because they couldn't take any other form of exercise. So they were walking up to the local hill, and he actually noticed that he got what he thought was a bit of chest tightness or chest pain. So his chest felt quite heavy getting towards the top of the hill, and actually had to sit down and just ask for the family to wait up for a few minutes whilst he got his breath back a little bit, and that chest tightness slowly went away over a period of about 5 to 10 minutes. At this point, obviously, his family were worried that perhaps he needed to get checked out, and he was actually due his 5-year blood pressure check at the GP, which he brought forward slightly, and he went and got a routine blood test and his blood pressure checked. Now, this showed that actually his blood pressure was a bit higher than we want it to be. So as Nirali was saying, ideally it needs to be below 140 over 90. And he found that it was higher than this at 155 and might have been like that for a while. He also found that his cholesterol was slightly on the higher side. And just for context, we like cholesterol to be sort of about less than 5, or even less than that ideally. And his cholesterol was a bit on the higher side at 5.7. So he saw his GP locally, and because of his episode of chest pain, the GP recommended some initial workup for this to check if he does have heart disease. And he was referred to the local hospital, who has a rapid access chest pain clinic, which is staffed by the cardiology staff to assess patients exactly like him. He also did something called an ECG, which is an electrical tracing of the heart, which can help us detect whether there's either any electrical problems with the heart, but it also helps detect any problems with the blood vessels in the heart causing heart disease. He was also discussed with him about possibly starting some blood pressure medications, which he wasn't that keen for at that time, and also further screening for any complications from his heart disease. So just quickly, this chap, Mr. Smith, he had symptoms of what medical professionals would call angina. So angina, what is that essentially? It's caused by something called coronary heart disease. Now that simply means problems with the vessels in your heart, so the arteries supplying oxygen and blood to the heart muscle. The main symptom that most people experience of this is what they would call chest discomfort. Not everyone would associate it with being a chest pain as such, but it can experience in different ways for different people. So some people may get a bit of a burning sensation in the chest. Some people might get what they feel is a very tight chest, where they can't breathe as well as they feel they should be able to. Or it may be a heaviness in the chest. So it may feel like someone is sitting on your chest and you just can't get your breath. It's usually associated with a difficulty in breathing. So you notice that your breathing feels tight as well. And therefore it can be very difficult actually to ascertain where this discomfort's coming from, because there's several things that people can associate with these symptoms, and not the heart isn't always the first thing that you think of. Because of the symptoms of shortness of breath, sometimes people think it's their lungs, and it very well may be. The other thing is that a lot of people experience heartburn, and this can cause a burning sensation in the chest as well. I mean, the main thing that we as doctors and in cardiology look at actually is the association of these symptoms with exercise. So anytime you exercise, and that doesn't have to mean going to the gym and really getting your heart rate up. It could be simply walking up your stairs in your house, or walking up an incline, say, to the shops. Now, angina typically happens in a typical way. So what you find is that it's quite predictable. So if you may find that your symptoms come with exercise, and then when you rest, so i.e. sit down or stop walking, it goes away within a few minutes. There is also a sort of subtype of angina chest pain, which can actually come on at rest, and you get the same symptoms that you perhaps were previously experiencing while walking, and stressing the heart to the point that you get some discomfort whilst sitting what we call at rest. So something like sitting in front of the TV in the evening, or sitting in the morning having your breakfast. So what's the difference essentially between angina and a heart attack? Because they are essentially the same disease process going on for the majority of the time. But they're different ends of the spectrum. So in angina, you might find that you can walk for a mile before you get discomfort and it may be caused by a slight narrowing of the vessels in your heart. Now, in a heart attack, you've developed, as you can see here on the screen, what we usually call an atherosclerotic plaque. So it's a buildup essentially of things like fat and cholesterol in the vessels of your heart. And they get to the point where they're narrowed so much that the blood flow to the muscle of the heart is compromised to the point where the heart isn't getting enough oxygen to do its job. And this is what causes the symptoms of a heart attack to come on. So, for example, and in this story, Mr. Smith has been out for lunch with a friend called Rita. And during lunch, this is a lady who usually gets heartburn and gets some burning sensation when eating too much. But she noticed that actually this time she was getting a real heaviness in the chest whilst sat down and eating. This developed over about 5 minutes to become quite a severe pain that actually is much worse than her normal pain from her indigestion. It then actually went on to travel up to her jaw, and she got some tightness in the jaw. And at this point, it was getting worse and worse, and she decided to phone 999. So what is the symptoms of a heart attack? So again, similar to angina, most people will get an onset of chest pain. One caveat to this is that you don't always get chest pain. And one of the other most common symptoms is being very short of breath, despite not doing anything to cause that shortness of breath. It can come on quite sudden. So it can come on all of a sudden up to sort of 10 to 20 minutes in duration, getting to its worst. The other common symptoms that we find is that you can feel particularly sick. You can even vomit. And another common one is that you can feel very sweaty and clammy. So you may feel like you're having a fever coming on, or you're coming out very clammy. And quite often other people so perhaps your relatives in the house may actually comment on this. Now, the key here is it's impossible for us to know if you're having a heart attack just from perhaps your symptoms. And if you're worried that this is something that's completely out of context for you or worse than something you've had before, if in doubt, call 999. Because as a clinician, what I need is for further tests to actually rule out a heart attack. And these are things like an ECG and blood tests. So Mr. Smith actually recognized that what he had before and perhaps didn't realize when he had to the GP was something called angina. And he's read actually online now that this can be a precursor to having a heart attack. And quite rightly, he got quite worried about this. He went back to his GP actually because he had been offered blood pressure medications before and thought, actually, yes, I do need to change something in my life so that I prevent this angina pain, which is currently not causing any damage to the heart, resulting in a heart attack. And actually, he went back to his GP, and one of the things he was particularly interested in was actually his diet, which he didn't think was the best, especially with his cholesterol being a bit on the high side. So I'm going to pass over to Dr. Mahesh Shah now, who's going to talk much more in depth about lifestyle interventions we can all implement possibly to reduce our risk of developing these angina and heart attacks.
Thank you very much, Dr. Key. Hi everyone, it's nice to meet you. I'm Mahesh, GP and nutritional therapist. So, just trying to get to the right slide. Sorry about that. Okay, so we've got the blue zones. So the blue zones are home to the longest and healthiest living populations in the world. Oh, sorry, don't know what's happened there. Slides have got a mind of their own for some reason. Okay, hopefully that stays there. So the blue zones, home to the longest and healthiest living populations in the world, with some of the lowest rates of overweight and obesity, high blood pressure, high cholesterol, diabetes, heart disease, and more. Why? Well, if we look at the bottom right-hand corner of this picture, you can see that they're all physically active. They have strong family and community, a positive mindset, and a good diet. And it's this last one that will be the main focus of this part of the presentation. So what is it about their diet that could be so protective? There we go. So we can look to the incredible work of Dr. Caldwell Esselstyn, who was at the world-renowned Cleveland Clinic in America. As a surgeon, he asked a question as to why those who underwent heart surgery, like bypasses, would come back again with heart problems. So his inquiry took him into the world of nutrition science, and he quickly understood the importance of something called nitric oxide. Now, on the left, you can see a blood vessel and all of its layers, with the innermost layer called the endothelium. And it's this endothelium that produces nitric oxide. And if we go to the right, you can see what it does. So nitric oxide helps to relax your blood vessels and keep blood pressure normal. But it doesn't just keep your blood pressure normal, it also helps to protect your blood vessels from damage and narrowing. So if nitric oxide is reduced, this can lead to high blood pressure and narrowing of blood vessels, as you can see the further right we go in this picture, which can eventually lead to angina, heart attacks, strokes, and other circulation problems. So what you see on the left is a scan of the heart. The red area shows where blood and oxygen is flowing really well to the heart muscle. But the part that is arrowed is dull and represents an area of heart muscle that has poorer blood flow, suggesting that there's a narrowing of the blood vessels supplying that part of the heart. The picture on the right represents one of the main blood vessels supplying oxygen to the heart muscle. As you follow it down, you can see how it narrows, which can lead to less blood flow to the heart muscle. So, what did Dr. Esselstyn find from his research into nutrition? He concluded that a low-fat, whole-food plant-based diet can maximize nitric oxide production, thus successfully preventing and reversing heart disease, and so the name of his book. So what is a whole-food plant-based diet? A diet that centers on fruits, vegetables, whole grains, and legumes, or beans and lentils, which are whole and as close as to how you would find them in nature. These foods contain vitamins, minerals, and phytonutrients, which are nutrients only found in plants, which can be anti-inflammatory, anti-allergy, antiviral, antibacterial, antioxidant, anti-cancer, and more. They're also a rich source of something called nitrates, which the body then converts to nitric oxide, thus protecting your heart and blood vessels and keeping them healthy. It's important to know that on a whole food plant-based diet, there are no animal products and is SOS free. That is, free of refined sugar, pressed oils, and salt. Why no animal products? Well, one of the many reasons is because animal products, especially meat, eggs, and dairy, contain high amounts of something called saturated fats. These saturated fats can increase cholesterol levels, can reduce nitric oxide, raise blood pressure, and narrow blood vessels over years. And the same effect can be seen with pressed oils as well, whether used to dress salads or in cooking. But the effects aren't just in the long term, but can be seen within hours of a meal. So this graph shows the impact of low-fat and high-fat meals on the relaxation of blood vessels over hours, as measured at the bottom of the graph. You can see that the low-fat meal with the white squares has virtually no impact on the blood vessels, but the high-fat meal with the black squares causes a dip in the line within 2 hours of having the meal, indicating a sudden reduction in nitric oxide production, leading to stress on and tightening up of the blood vessels. And you can see that this can last for up to 6 hours after the meal. And the same thing is seen with salt, with high salt meals as represented by the white square line. But also notice that the low salt meals also has an impact on the blood vessels as well. And just a quick word on alcohol as well. Before it was thought that moderate amounts of alcohol can be protective for the heart, but we now also know that any amount of alcohol can indeed increase your risk of high blood pressure and narrowing of your blood vessels. So Dr. Esselstyn actually did his own study. What did he find? Well, his colleagues who were dealing with some of the most complex cardiac patients who had nothing else really to offer them, referred their patients onto Dr. Esselstyn. So he counseled 198 patients in following a low-fat, whole-food, plant-based diet and followed them for nearly 4 years. Now, 21 of the 198 weren't able to keep up with the diet. And by the end of the study, what they found is that 13 of the 21 had some form of major event, such as a heart attack, stroke, or death. Whereas in the 177 remaining who were able to maintain a low-fat, whole-food, plant-based diet, there was only one major event, and that was a stroke. So this information really does show you what a plant-based diet can do. Now let's go back to the blue zones and have a look at 3 of them. Loma Linda in California, Sardinia in Italy, and Okinawa in Japan. Now they all have their cultural variances. However, if we look at where their circles cross over, we can see what they all have in common. So let's take a little closer look at this. So as we can see, they all have strong family and society. We know the impact that loneliness can have on our health and happiness, so togetherness is really important. There's also no smoking, and they're all physically active. So if we can get 20 to 30 minutes of heart pumping exercise in a day, then that's great. And incorporate more exercise into your day-to-day routine. For example, walking to the shops or parking on the other end of the car park, using the stairs at work, getting off the train or bus a few stops early, and so on. Anything can help. And what we can also see is that they all consume legumes, that's beans and lentils, which are known to have great benefits for our health. And in the center there, they all consume a plant-based diet. Well, let's take a little bit more of a look at Loma Linda in California. They're an interesting group because, in fact, their diet has quite a variation in both animal products and plant foods present. So researchers wanted to study the impact of the various dietary practices on health. They identified 5 groups: non-vegetarians, semi-vegetarians who eat less meat than the non-vegetarians, pescatarians who don't eat red or white meats but do consume fish, eggs, and dairy, vegetarians who consume animal products in the form of eggs and dairy, and vegans, or those who are plant-based, who do not eat any animal products. And this is what the researchers found. Note the groups on the left. Next is a column for BMI, which is a rough indicator of how healthy your weight is. A healthy BMI is considered between 18.5 to 25. Overweight is 25 to 30, and over 30 as obese. What you can see is that on average, the less the animal products you eat, the healthier your BMI. However, notice one thing. Only the vegan group, on average, managed a BMI less than 25. The next column shows rates of diabetes. Now, if you consider the number 1 here in the non-veg row as 100 non-vegetarians with diabetes, below that, there were 72 semi-vegetarians with diabetes, 49 pescatarians with diabetes, 39 vegetarians with diabetes, and only 22 vegans with diabetes. And you can see the same sort of pattern with high blood pressure, with the vegans having the lowest rate again. So those who were plant-based had the lowest rate of those diseases, each of which we know is a risk factor for heart disease. And hopefully you can now understand why this is through the positive effects of nitrates in plants and the detrimental effect of animal fats. So a whole food, rainbow-colored, plant-based diet has the ability to prevent and reverse diseases, including heart disease. Remember this picture we saw earlier? Well, without any drugs or procedures, but after 3 weeks on a plant-based diet, you can see blood flow restored to the heart muscle. And remember this severely narrowed blood vessel in the heart? Now look at it after a plant-based diet without any medications or surgical procedures. Fully open again. This is the power of plants. This is the life-transforming ability of a plant-based diet. And here is a little tip for really boosting your nitric oxide levels. So this is a list of plant foods on the left, which represents some of the most nitrate-rich foods. When you eat these, the body converts the nitrates into nitric oxide. However, adding some drops of balsamic vinegar to this further boosts the production of nitric oxide. So a useful tip is steaming some of these vegetables for several minutes and then add some balsamic vinegar and some herbs and spices to your taste. And it makes for quite a satisfying starter, snack, or side dish. So, Doctor, this is amazing info, but how can I learn and incorporate these changes into my already busy life? Well, fear not. There are many resources, and here are a few picks. So these two resources provide many easy to follow recipes for all times of the day, breakfast through to dinner, snacks and desserts. And for those who are familiar with the Indian cuisine, you can still enjoy all your favorites, but in a healthier way, with many recipes and tutorials on this third website. So you're really not giving up anything, rather you're learning new skills and enjoying a new experience. Well, thank you for listening. I hope the information inspires you into more research and embracing a healing path for your life journey. Sairam.
Thank you all. So now we'll just open the floor up for any questions. Thank you.
Cheers, Haram. My name is Dr. Sharavan Janab. I'm Region 1 Health Service Coordinator, and I've been kindly invited to coordinate the question and answer section of this evening following such an informative session. First of all, please accept my thanks to our speakers, Dr. Thomas, Dr. Mahesh, Sister Nirali, for taking on this challenging task of trying to talk about such a vast and important topic as cardiovascular disease in such a short period of time. I found it very engaging. I have a number of questions submitted, as well as some challenging questions posed to me by my patients as well. And I would be grateful to pick your knowledge and experience in addressing these queries, uncertainties, and doubts. First of all, if I may, Tom, some really sobering statistics that you gave us at the beginning of the talk. When considering that 460 people a day were dying of heart or secondary disease, and it's quite shocking to hear that, especially in the context of an ongoing sort of pandemic at the moment. In terms of risk factors, you mentioned a number of them, but in this new year, with New Year's resolution, you could focus on, a few things. Which risk factors do you think would be the most important to focus on?
Hi, yeah, thanks. I think I got your question there. There was a bit of echo in the background. I think the question was in terms of with the new year, what's the thing we could focus on most importantly in terms of risk factors? Is that correct?
Yes, absolutely.
Oh, fantastic. So I think as we lined out in the talk, there's a lot of big things that can increase your risk of cardiovascular disease, and some of which many people at home might know that they suffer from themselves in terms of their past medical history. So there's things like high blood pressure, like Nirali talked about, but also things like diabetes, your weight, how much exercise you manage to do, and your diet as well are big risk factors for heart disease. I think what I would always suggest is making sure that anything that you know is a risk factor for yourself that can be modified in terms of you can make a difference to that is a good place to start. So for example, if you know that you already have a diagnosis of type 2 diabetes, making sure that you're attending your regular appointments at the GP to get your diabetes checked up, to make sure that you're getting your HbA1c blood test done, to make sure that you're optimized from that point of view, because you already know that that's something that does put you at increased risk of heart disease in the future. There's also changes we can make in our day-to-day life, which perhaps aren't as measurable in terms of being able to do a blood test and say, yes, we've improved our diabetes control. But small changes like swapping the car for walking to the shops, for example, and making healthier life choices with our foods that we eat, and with alcohol and smoking, are wins that we can get basically from tomorrow. Whereas medical conditions like hypertension and type 2 diabetes are things that perhaps take a bit longer to get on top of. And also there are some, what we would say, non-modifiable risk factors, such as a family history, but that doesn't necessarily mean that we can't, from say tomorrow, start to make positive changes to our life to reduce our risk almost instantaneously, and then increase that gain from what we're changing over time.
Yeah, I completely agree there with what Dr. Key is saying. All really, really important points. Looking at your lifestyle is one of the key things, because we do understand that, in fact, it is lifestyle that is very much the overbearing cause and underlying sort of effects of these disease processes, and as well as looking at things like looking at risk factors that you already might have, food and exercise. I think the other very important thing as well to consider here in terms of lifestyle and what we can do is looking at our stress levels as well, and also looking at things like sleep quality and all of these things, because stress and sleep, or lack of good sleep, can also induce or increase inflammation in the body, and we do understand that cardiovascular disease has very much at its base an inflammatory component and process going on. So yeah, absolutely, a holistic approach looking at all lifestyle pillars and factors is important.
Thank you. I was going to ask Mahesh, I mean, in trying to address some of these risk factors, whether professionally when advising patients or personally, I know that there are challenges in knowing sort of how to take sort of first steps. How important is it to have a plan? And, if you did have a plan, what would this look like in reality?
Yeah, absolutely. I think in anything, it's always important to have a structure and a plan. And that can even be a structure for a pre-planning. So, for example, in my practice as a nutritional therapist, which is very much separate to my role as a GP, there is a lot of pre-planning in terms of understanding the underlying causes of the disease process that may be going on, whether it be understanding it on a biological level and also understanding it on a sort of a lifestyle level. What are the factors that are causing this to occur in the first place? So if you're able to understand the root causes, then you can then structure a plan appropriately as to, okay, how do we go and tackle this and improve this? And then having a step-by-step process is very, very important. So just very quick examples that I may have as part of my therapy practice would be having food plans, having diet plans, having exercise plans, and all sorts of other things, so that people are able to more easily process what needs to be done and what needs to be changed and how it can be done. So absolutely, planning and structuring is really, really important. People can feel very passionate about going straight into it, which is great, but sometimes that can also leave you with no fuel at the end, or a lot quicker. You could run out of fuel. So it's always important to have a good structure and plan in place so that you can do things steadily and sustainably.
Excellent, thank you. I mean, Sister Nirali, I have a few questions in relation to sort of medications and side effects. I mean, I have a multitude of patients in my own practice who are worried about side effects of drugs and things. I mean, what are the kind of common side effects that patients might get with drugs like this? Just whilst we're getting up to speed with the technology, if I could, yeah, no, I heard a whisper there.
Yeah, okay, yeah. Am I audible?
Yes, yeah. I can hear you now,
Excellent.
Loud and clear. Thank you.
Apologies for that. So yes, so thank you for the question. So many patients may start off on a medication called ACE inhibitors, and they include medications such as ramipril or enalapril. And so anything with a pril on the end is an ACE inhibitor. And some side effects some people may get is a dry, irritating cough. Now, this isn't something typically to be worried about. It's just the way in which the drug actually works. And the most kind of irritable thing about that side effect is literally that it's annoying for people to actually have that side effect. So if you find that you're getting this dry, irritating cough that doesn't go away, you do have the option to switch to something else, which is called an angiotensin blocker as well, or an ARB. Now that's something like losartan, which some patients may be on as well. Now, ACE inhibitors are really good in that they can also be protective for your kidneys as well. The other medication that some patients may be on as a standalone therapy or an additive therapy is something called calcium channel blockers. So things like amlodipine. Now, some patients may get kind of swelling of the ankles. So sometimes that can go away, but sometimes that does persist. And for some patients, it may be quite uncomfortable, in which case we would consider alternative treatment as well. There are so many blood pressure medication options out there that, you know, if patients are uncomfortable on the ones that they're on, we can consider switching them to something else.
Excellent, thank you. I mean, can I ask, I mean, do you think that patients should persevere with such medications, or do you think that they should sort of stop them? What should they do if they're getting these kind of things?
So to be honest, I know a lot of patients have a lot of reservations about going on to medications in general. So I think with the lifestyle interventions, you could, if you make those lifestyle interventions, you can actually come off of those blood pressure medications. And that's literally about monitoring your blood pressure, seeing how you feel within yourself as well. And that will give you really good indicators about when you can come off it. I mean, in my practice, I take patients off their blood pressure medications all the time. You know, they may come in actually that their blood pressure is now in range, they're feeling a lot better, their cholesterol's come down, you know, they've implemented lifestyle changes. And, you know, we have that discussion with the patient. I think it's really important to get the patient's perspective as well. And then we decide whether, okay, let's take them off the blood pressure medications and let's then monitor for another week or two, see how they get on, and then we'll take it from there.
I mean, a question which I just got asked of medication and the importance of taking them, you know, especially with regards to what are your sort of thoughts about sort of compliance and concordance with taking the medications?
It's really vitally important to take your medications as prescribed. From a pharmacy perspective, I mean, a lot of patients say, well, I can't feel my blood pressure, therefore, how do I know that I even need these tablets? The problem is that hypertension, although sometimes you can't always feel it, the impact that it actually has within your body happens silently. And it's only when something serious happens, like angina or a heart attack, that you realize that if you had got your blood pressure under control in the first place, then all of these other conditions may not have been precipitated as well. Hypertension can cause so many different diseases, you know, right down to kidney disease as well. So if you get your blood pressure under control, that means that you're kind of mitigating anything that could happen in the future as well. So take your medications as prescribed. Take them at the time that has been suggested to you. If you find that you're having trouble with taking your medications in the morning, for example, you can always take them in the evening, but it does depend on the medication. And it's always worth speaking to your pharmacist or your GP if you're having trouble with any of your medications. The pharmacists and the GPs at your practice would be conducting medication reviews with all of the patients. It's something that they are pushing nationally as well from the NHS. So if you haven't had your annual medication review, then you can always call up your GP surgery and also ask them, when am I due a medication review? And that means that we have the opportunity to talk about your medication, see whether they're working for you, and see what can be taken off or changed. Because sometimes patients are on medications for a number of years that they don't always need to be on. And that's a really good opportunity there to ask any questions that you need to.
Thank you very much. I think you've very skillfully covered two other questions in relation to sort of symptoms of high blood pressure, as well as patients, where can they go if they do have any doubts or concerns, about their medications. Tom, if I could ask, a question that was submitted on the comments, there can be this sort of uncertainty sometimes with the chest pain type symptoms as to when to precisely sort of go to hospital with these sort of things. If a patient's not really sure whether they're having heart pain, should they go to hospital?
Yeah, I think that's a really good question, because it's something we touched on in the talk, that there's multiple other things that can cause chest pains that are similar to a heart attack, and how do we know how to differentiate between something that is not so serious and something that's as serious as a heart attack. Now, the problem we have here is that with a heart attack, literally time is really important. So as we can see from the session, when you're having a heart attack, it's when blood flow to part of the heart is blocked for a certain period of time, and the longer that that's blocked, the more damage can be done to the heart. In my day-to-day practice, I quite often see patients who have perhaps tried to go to bed, they've gone to sleep even, or they've tried to ride through the pain because they don't want to bother anyone, and they're presenting much later with their heart attack, and that's causing a much more significant damage to the heart. As cardiologists in hospital, the best we can offer someone is when they've presented to us as early as possible, so that time period where there's not enough oxygen going to the heart is very limited. Now, there's other things that can cause chest pain, and one of the most common things is what we call acid reflux or indigestion, and I'm sure a lot of people watching will experience those symptoms as well, and they tend to be more of a burning type pain, sort of just under the rib cage, perhaps coming up to the throat. And as you can see from the vagueness of that, it's something that is quite hard to differentiate from chest pain that's cardiac in nature, or what we would call cardiac in nature, which was more of a crushing or a pressure type pain on the chest. The problem here is that patients don't necessarily always fall into a neat category for us as doctors, and we can see you walk through the front door, you say 2 sentences, and we say, yes, you're having a heart attack or not. So I would say if someone's having chest pain for the first time, especially if it's at rest, then I would advise them to, if they're worried and they're worried that it may be a heart attack, to call 999 and either present to hospital or paramedics to come and at least do an ECG on them to rule it out, and they may need some blood tests as well. It may be that they know their bodies a little bit more because they've had chest pain before, or they've had reflux before and can recognize it being the same symptoms. The thing to not fall into the trap of there is that if you do get, for example, indigestion, and you can then blame all your chest pain on your indigestion. If you do get pain that is starting to get worse, it's happening on exertion, or it's a different type of pain, you still need to present to a health practitioner so that we can make sure you're not having a heart attack.
Thank you. Thank you. Mahesh, if I can ask, I mean, sometimes when patients are presenting to me, they can get quite demoralized by the prospect of a lifetime of pills if they're being diagnosed with, say, high blood pressure or diabetes or cardiovascular disease. I mean, a question on the comments backs this sentiment. Is it true that once you're on blood pressure tablets that you have to take them forever?
Well, I mean, we're seeing a lot of heart disease, diabetes now, and it's a growing problem. And I think what we need to understand is that our lifestyle has a big role, a significant role to play in the development of these disease processes. So if the underlying cause of these disease processes is our lifestyle, then essentially the solution is our lifestyle. Essentially, medications are there to be able to control the symptoms and to maybe slow the progression down of a disease process. So, so essentially, to then be able to understand what is actually happening in my body, what is the root cause of a problem, and to be able to then rectify that and to address that, you then have the ability or the chance, with the support of your doctor, with the support of other relevant practitioners, to potentially be able to come off medications or not need medications, being able to improve your condition. But also there's a plethora of scientific evidence showing the successful reversal of these chronic disease processes as well.
Thank you very much. Thank you for that. I think last of all, and most importantly, a personal question. I noted on one of your slides that one of the blue zones was Sardinia, which is in Italy. I therefore assume that living in Sardinia must be a positive factor in reducing the risk of us having a heart attack and increasing life expectancy. Would you recommend that all of us move to Sardinia to improve our cardiovascular health?
Sure, why not? Although we might find travel a bit difficult in these times. But the important message here is that it would be great to move to Sardinia, it would be great to move to Costa Rica. But the important thing we should understand and take away from the research that we have from these areas is that the things that they have that make them so healthy, we can take a few of their tips and points and bring them into our lives. So we can make healthier choices with our food. We can exercise. We can stay connected with our family, friends, and communities, even though it is difficult in these times, but that's really, really important. And we can together also make sure that we do have a positive outlook, a positive mindset, because these things are really, really important for our overall health and well-being, especially in these difficult times that we're facing at the moment.
Thank you so much. I think on that really positive note, I will take away all of the messages that you have shared with us. I'm also going to start making plans to move to Sardinia on doctor's orders. I wish to give my profound thanks, first of all, to our beloved Bhagavan Sri Sathya Sai Baba, first of all, for playing games with us with the technical gremlins, and for also lovingly giving us this opportunity to meet together and discuss these important matters. To our respected speakers this evening, Dr. Thomas Key, Dr. Mahesh, Shah, and Sister Nirali Sisodia, and also to you, the audience, thank you for protecting this time, for being with us. I hope that you have found this informative, thought-provoking, and inspirational to make some positive changes in your lives, and anticipate that you will be asking for more such talks. I am happy to state that the next session will be held on Tuesday, the 2nd of February, same time, same place, here in the digital world, on dental health and self-health management. I hope that you will be able to join us then. In this new year of 2021, I pray that you remain safe, well, healthy, and have a prosperous, joyful, and peaceful new year. Jai Saram.